Now, measles is a viral illness, but in children who are not vaccinated in immunocompromised hosts, we can get severe complications.
How can parents strengthen their child's immune system to fight off infections like measles?
Yes, that is a topmost question in every parent's mind.
With rising cases and increasing concerns, it's important to understand how measles spread, its symptoms, prevention, and role of vaccine. To help us break it all down, we have Dr. Anshu Sethi, a pediatrician at Cloudnine Hospital, Baner, Pune. Welcome, Dr. Anshu.
Thank you for having me here.
So, Dr. Sethi, what is measles and why is it a serious concern for children?
Measles is a very important virus. It's a respiratory virus caused by the measles, which is a highly contagious virus from the family Paramyxidiovirus. It is a serious concern in children, especially under age of 5 years, because it can lead to severe complications and is a high cause of morbidity and mortality, especially in low resource settings and in children who are not vaccinated completely.
Okay, so how does measles spread and what are the early symptoms parents should watch for?
Measles is spread by respiratory route. It is spread by aerosols, infected aerosols during coughing or infected respiratory secretions by contact. Parents should watch for any symptoms of fever, coryza after contact with a child with measles. The symptoms start 1 to 2 weeks after the exposure and they can spread with fever, coryza, non-purulent conjunctivitis followed by Koplik spots in the mouth on the buccal mucosa. This can be followed 3 to 4 days later by an exanthematous rash, which is maculopapular, spreads from the face right till the lower trunk, and it is a blanching rash. This occurs along with high-grade fever, and the child may develop secondary complications like otitis media, severe respiratory symptoms, pharyngitis, and in few cases may lead to pneumonia or some neurological problems as well.
Oh. So, doctor, what complications can arise from measles and who is at the highest risk?
Now, measles is a viral illness, but in children who are not vaccinated in immunocompromised hosts, we can get severe complications. The complications can range from a multi-system involvement. Respiratory complications are known to have pharyngitis, pneumonias, including giant cell and interstitial pneumonias. And children can also have neurological complication, which is a very dreaded complication. They can develop acute ADEM, which is called acute disseminated encephalomyelitis following measles, and a rare complication also SSPE, which is also secondary to measles. It can develop with seizures. And measles also leads to secondary, like a immunosuppression with secondary bacterial infection, leading to diarrhea, secondary bacteria, and even other complications in which the child can become weak with failure to thrive.
Oh, okay. So, doctor, how effective is the measles vaccine and at what age should children get vaccinated?
Measles vaccine, which has come up, has really changed the scenario of measles in India. Because of the vaccine, all the disease burden has become very less. With 2 doses of measles vaccine, it is almost 95 to 97% efficacy. And the vaccine schedule starts from the Indian Academy of Pediatric Government. It starts at 9 months, second dose at 15 months, and the third dose can be given at 4 to 6 years of age. Catch-up vaccination schedule is also available for children who have not taken the vaccine.
Okay. Are there any side effects of the MMR vaccine and how do they compare to the risk of measles itself?
The side effects of the vaccine are very less. It is a live attenuated vaccine and it is hardly known to have any side effects except some local reactions like swelling or mild fever. The benefits of the vaccine outweigh the risks, because as we described, the risks of measles is so completely dreaded. It has known to lead to so many complications. So giving the vaccine is very useful. It has 95 to 97% efficacy.
Okay, that's great, doctor. So, doctor, what should parents do if their child has been exposed to measles?
That's a good question. If the child has been exposed to measles, the parents should isolate the child to prevent infection in other siblings or other schoolmates, at least for 7 days, even after the rash appears. They should seek immediate medical help, give antipyretics as the doctor advises, keep the child hydrated, and look out for complications Complication in the sense secondary bacterial infections, respiratory problems, GI problems, or any neurological problems, and seek medical advice as soon as possible.
Okay. How can parents strengthen their child's immune system to fight off infections like measles?
Yes, that is a topmost question in every parent's mind.
Yeah.
Not only measles, all viral infections are driven off with good immunity. So the baseline or the golden rule is to have good immunity in the child. This comes with a balanced diet, weaning of the child early after 6 months, introducing solid foods early at 6 months of age with a healthy diet including carbs, proteins, vitamins, fruits, vegetables. And most importantly, child should have adequate sleep, outdoor playing, means a healthy lifestyle. Vaccination on time is very important. We should seek proper vaccination schedule of the child, which should be completed. And most importantly, healthy lifestyle and balanced diet in the child.
Okay, that's great, doctor. Thank you very much, Dr. Anshu, for sharing your valuable insights on such a crucial topic.
Thank you very much for having me here.
Thank you. And to our listeners, if you found this episode informative and helpful, do share it with others and subscribe to our channel for more such informative videos. Until then, take care and stay healthy.